today's conversation is around sexual health after having a baby.
It's been shown that over 80% of women face some form of female sexual dysfunction after having a baby. Women who have low libido after having a baby, so nothing happened, the delivery went fine, but they just have low libido after having a baby.
Hormones?
That could be hormonal, or it could be psychological as well. Because because sometimes during breastfeeding, prolactin is the hormone that helps us to breastfeed. Prolactin levels can go really, really high, and that really lowers libido, actually both for men and women. One of the other things that can affect sexual health after delivery is contraception. So when the baby is now 6 weeks, you start looking into contraception. You're like, okay, you don't want to get pregnant immediately, possibly. And so because of breastfeeding, women tend to be advised to have progesterone-based contraception because progesterone does not affect breastfeeding. You can't have estrogen in your contraception. So basically now what you're looking at is having either an implant or an IUD or a progesterone-only pill. Or a progesterone injectable. Now, the problem with progesterone contraception is that it lowers libido. Really does, and it causes vaginal dryness.
Oh yes, I was going to say that.
I get actually a lot of my patients who are on progesterone contraception who don't want to continue with it. Their partners actually bring them over and they're like, "Hey, this thing, man, libido is gone."
Like, I'm giving you this progesterone so you can have sex. But then you can't have sex. Hi guys, welcome to our channel. Hello everybody, welcome back to another episode of Over 25. Yay. As you can see, we have a very special guest here, and this is not a new face on Over 25. Every time we have Dr. Christina Sule, you know it's going to be a conversation around the vagina and the vulva and sexual reproductive health. Am I right? Dr. Christina Sule is a very well, how do you say, like when somebody is not celebrated, decorated doctor. She's not just a gynecologist. She has her own practice called Allura Medical Practice, where they do obstetrics, general and cosmetic gynecology, and intimate wellness. Those are the services that she provides. Welcome, Dr. Christina Sule, to Over 25.
Thank you so much for having me once again. Asante.
I am Jules _her on my Instagram, or you can find me on my other YouTube channel, my tiny little channel. And to my left, I have...
My name is Shiki, also known as Miss Tiramisu on Instagram.
And I'm Lonzi Gatabaki on Instagram.
Yay! Okay, guys. So today's conversation is around sexual health after having a baby. This is a conversation I thought that would not even be important for me. I was like, can the moms just be on this episode? Oh, speaking of not all of us being here, Ivy is not around, guys. She's busy doing other things, so she's not able to make this episode, but it's fine. So we still feel like we are full house because we are four. But back to that, I wanted the moms to take, I was like, see, the moms just be on this episode. Me, I don't need to be in it. But then you said something just as we were just having a conversation before we started to record, that there's stuff that happens before you have a baby that affects your sexual health after the baby. So I think just start us off, Dr. Christina. What's all that about? Why is sexual health for pregnant mothers or people who want to have babies important?
Well, it's important because it gets ignored a lot, and yet it's something that really bothers moms after they have a baby. They really struggle with that. And pregnancy itself is a process where there's a lot of biological changes, there's a lot of psychological changes, there's even social changes. And so actually over 80% of women in studies, it's been shown that over 80% of women face some form of female sexual dysfunction after having a baby. And majority of those women, their sex life does not actually return to its baseline. So we don't want it to get much better or much worse, but we're just hoping that it can return to baseline. And with that number, majority do not actually return to baseline. And because it's something that I think culturally and socially women are made to ignore, like, you know what, you shouldn't want your sex life to get back to what it was, like, they're shamed for it. And so there's something that's not discussed. It's something that healthcare workers really brush off a lot. And that's one of the reasons why it has to be discussed, because it's a real issue. Women don't want their lives to end around having a baby. They still need to go back to being a wife. They still need to go back to being, a sexual partner to someone. That's not where life stops. And so this is something that's really important to just not only discuss, but also find solid solutions too.
Okay.
Yeah.
Can I ask a question before we proceed? What is sexual dysfunction? Because you had mentioned some ladies experience
sexual dysfunction.
All right. So sexual dysfunction, especially in the postpartum period, is basically when a woman is not able to sexually perform the way she used to. And that can come in very many different shapes and forms. Some women get really bad vaginal dryness after having a baby. Some women get lack of vaginal wall sensitivity. So the walls are just not as sensitive as they used to be. The G-spot is just not as sensitive as it used to be.
Oh, wow.
Yes. Some women get, for example, vaginal laxity, where the walls of the vagina get to stretch a lot during pregnancy and delivery, especially if they have really big babies. We call that fetal macrosomia, when the baby is over 4 kilos and the woman has to give birth vaginally. That's a problem. Women who deliver and get either an episiotomy or a really bad perineal tear that has to now be stitched up later. Of course, afterwards, there's a possibility that they may have painful sexual intercourse or lack of sensation. Women who have low libido after having a baby. So nothing happened, the delivery went fine, but they just have low libido after having a baby. Hormones? That could be hormonal, or it could be psychological as well. Because because sometimes during breastfeeding, prolactin is the hormone that helps us to breastfeed. Prolactin levels can go really high, and that really lowers libido, actually both for men and women. There's some men who have conditions where prolactin is really high, so their libido drops, and the same happens for women. So female sexual dysfunction after a baby looks like that. It's dryness, it's low libido, it's laxity, it's just psychological problems, unwillingness to be able to have sex, or lack of motivation. And of course, as we discuss, I'll be able to tell you like what causes some of those things. But that's what it looks like.
Off to a difficult start.
Wow. So what would you say influences sexual health after having a baby?
After having a baby, there's many things that can influence your sexual health. The first thing is...
Or even before. It could be before and after. You can give us both.
Okay, let's start with before.
Before.
So before a woman ever gets pregnant, there are certain things in her life that can influence her sexual life even after having a baby. For example, if she goes through a really rough time with infertility, that's something that can affect her sexual life after that, because she really struggled to get her pregnancy. If she's successful, the chances of her having a better sex life are higher, but if she's unsuccessful and continues to battle infertility, that could affect her sex life later. Women who have miscarriages and terminations of pregnancy. I've had several patients who come in and they've had a termination of pregnancy, and afterwards their sex life is affected, either immediately or even after having a baby. Women who have, a damaged body image. Before they get pregnant could actually have it much worse after a baby, because the body is going to change during pregnancy, and then now after delivery it's going to change even more. And so if their image was poor to begin with, then of course later on it gets even worse. So those are some of the issues that can affect your later sex life even way before you get pregnant.
And after childbirth?
So maybe first we can talk about during childbirth. Because there are certain things that can happen during pregnancy and childbirth that will affect your sex life even after. So during pregnancy, of course, the body really changes once again. As I had mentioned, there's a lot of weight gain, and even just the way the body looks. So of course, culturally, and I think socially, we've been made to believe like, you get really fat, your body is round, it's not curvy, it's not shapy. And so in our minds, we already have this conception that, your body doesn't look the way it used to. It's not beautiful, it's not sexy, exactly. Which is actually a lie, because like pregnancy and the shape during pregnancy should be celebrated, you know, because it's really beautiful. And the beauty about it is not even like necessarily what it looks like, but what it symbolizes. Like you're carrying a life, you know. That's really not the time to be looking at what shape it is it sexy or not, and all that. That being said, other than like body weight and changes, like sometimes we have hormonal changes, which also, you know, kind of lower libido, and sometimes those hormones do not recover after delivery, because there's usually surges in progesterone goes really high, estrogen goes high, your body starts producing more prolactin, and as I had already mentioned, that's something that lowers libido. So hormone changes can happen during pregnancy. Some women actually have increased libido during pregnancy, some it's really decreased and then does not recover after delivery, right? And then also the kind of delivery that a woman has. So if it's a very traumatic delivery, you know, maybe your baby had to be vacuumed out, maybe you had to have an episiotomy, maybe you had to have a perineal tear, or sometimes even an emergency cesarean section, that kind of physical and emotional trauma could affect your sex life afterwards, and women who have a difficult delivery, we're talking about women who've had perineal tears, women who develop urinary incontinence during the labor process and after. You know, if you're not able to hold urine after delivery because you had a very difficult vaginal delivery especially, of course you're not going to, you know, want to be sexually active, you're not going to feel sexy because your urine is leaking. Whether you like it or not, you cannot contain or hold the urine, especially after.
That can be fixed,
That can be fixed depending on what the issue is, but yes, there are some surgical solutions to it. Women who
it's a lot to have a baby. It's a lot.
It is. And sometimes even like, for example, during an episiotomy or a really bad perineal tear, there's nerve damage in the vagina. So the sensitivity is going to really decrease. Because if I'm cutting your vagina,
for sexy time.
Like you won't feel
to the level you are feeling.
To the level you are feeling
you won't
previously.
feel the horniness.
No, that's libido. It's just the actual tactile sensation inside the vagina.
Like the G-spot.
It's almost numb. Yes, in certain places. So that can happen.
Is the perineal tear an extreme one is what you call a fistula?
So now I was just about to get to that.
Okay.
So a perineal tear is tears that happen towards the outside and maybe sometimes even extending towards the cervix. But a fistula is when there's a communication between, rather a vaginal fistula is a communication between the vagina and another part. So you can have a rectovaginal fistula, which is a communication between the rectum and the vagina. And what happens is usually when women...
What's the communication?
What is communicating?
So what that means is that during labor, especially labor that's obstructed, the vaginal walls stretch out so much and get so thin that they literally form a small hole. And so stool can come from the rectum and enter the vagina and come out of the vagina.
But the rectum doesn't have a hole?
So it's two walls that are close to each other and they're stretched out by the head of the baby so thin that the head literally tears both the vagina and the rectum, and now stool can go into the vagina. So that's a rectovaginal fistula.
It happens inside.
It can happen at any level in the vagina because the entire vaginal wall is in contact with the rectum. Then you can also get.
No wonder, like when you guys feel like you poop a lot more when your period is about to come. That's how I know my period is coming.
Even during my period.
Because I think even during your period, because when I'm cramping before my period, like I'll know when my period is coming because like today I've gone to the loo like 5 times before 11 p.m.
So that's kind of because when your uterus is contracting, it irritates your rectum because it's lying on your rectum. So your rectum is always feeling like I need to empty. Then you could also get a vesicovaginal fistula, which is where now the same head of the baby, because the labor is obstructed, it's a poorly managed labor. Fistulas happen when a labor is poorly managed. They're not just they don't just happen to everyone.
There's a content creator who went through that, but I didn't know it was. I thought it's just bad luck. I didn't know it was poor management of labor.
It's poor management of labor because when you see that labor is obstructed, really you must stop and just have a cesarean. There's no need of insisting on a vaginal delivery when you can actually see that this labor is obstructed. It will not happen. If you force it to happen, there'll be consequences.
And as the patient, can I say, hey guys, it's looking like we're not getting anywhere. Can we go to CS?
Yes,
Will they
you
listen
can.
to me?
Yes, you can. It
Okay.
depends on the doctor that you have.
Okay.
Yeah, if you have a private doctor, that's a discussion that you can have.
Okay.
In a public hospital, it may not be a discussion that you can have with your doctor. But at the same time, remember, there are many times that patients, because labor is very, very painful.
You're like,
there are
I'm
very
dying.
many times patients say that, like, even before proper labor has started. So if we listened to every patient that says that, we probably section everyone, which is not what we're trying to do.
Yeah.
But yes, with a private doctor, many times you can just say, look, I'm really tired, or I don't think I can finish this process.
Do this.
And then depending on the kind of doctor you have, maybe they'll explain to you the benefits of continuing with your vaginal delivery, the benefits of having a cesarean at that point, you know, and then now you can make a decision together, which is how it should be.
Okay.
Yeah. So I was saying about the vesicovaginal fistula. It's when this same head of the baby stretches the bladder, the vaginal wall, the urethra and the bladder so thin that now urine can just leak directly into the vagina. So not only is it a form of incontinence because the urine is leaking, but it's actually coming out through the vagina. Yeah. So you can imagine that process is not sexy. Like you're not going to want to have sex when that is happening, other than the fact that you actually need treatment. Like this is a serious condition. It could get really bad. It could get infected because ideally urine is not supposed to be in your vagina. So these are some of the conditions during pregnancy and during delivery that could really affect your sexual health. Honestly, if your incontinence or fistula is fixed even after delivery, that's something that can still really affect you. The fact that you had it, the fact that your partner saw you in that way, these are things that could actually really affect how you perform sexually after.
I would even imagine you're just like, I don't want anything going
to
in
do
there.
with sex. Exactly.
I don't want anything messing up with anything.
Exactly.
Like I can imagine.
Yeah, man.
Random. I've just realized. So even like that's why even when during rape people get fistulas, especially small kids.
Exactly.
And
and also sexual dysfunction after rape. So that's something that can happen before a pregnancy that can affect your sex life after. Because remember, after you deliver, you're in a really vulnerable state. You have a person depending on you. You've gone through this really big and potentially emotionally traumatic process. You don't want a repetition of some things that happened prior to getting pregnant. So rape is actually one of the things before pregnancy or sexual assault of any kind that can affect your sex life during and after pregnancy as well.
All right, so that's a bit traumatic to hear. Lona, I hope you're okay.
I'm really not.
Lona is quiet
over here.
She knows now what to expect.
So what else do you think can happen during pregnancy that can affect your sexual health?
So women who have a high-risk pregnancy can sometimes end up having a really difficult sex life afterwards. If you're pregnant and maybe you had to be on full bed rest, or you bled a lot during pregnancy, or you almost lost the baby during pregnancy, any high-risk pregnancy can really affect the sex life after because it's trauma. And sometimes during the pregnancy, you may seem fine and you're trying to cope and trying to be there for, your future child, your unborn child. But then afterwards, that's when everything, when the dust has settled, it can really affect you sexually. And also after delivery, women who have a baby who requires a neonatal admission can have really severe sexual dysfunction after that.
Neonatal admission?
So when your newborn has to be admitted either in the newborn ICU or the newborn HDU, really it's not something that you can recover from easily, both emotionally and sexually. And then also women who have very poor partner support during pregnancy can actually end up not being able to perform sexually afterwards, because if the person who you've conceived with, or even a different person who you're with, because it's not always the person you've conceived with, is not there for you during that pregnancy and delivery, afterwards it becomes really difficult to perform sexually. Some women are able to, and good for them, but some are just absolutely not able to perform.
So I feel like it just shows you that sex in general is it starts here mentally.
For women especially
for women. Like you need, there's a lot that happens here before we can be in the space like here. I wanna fuck.
I even wanted to add to that, when you've talked about poor partner support, one of the things that I have realized, and many women I've spoken to, I think, realize when you're pregnant is, men, our bodies can really do the thing. Like I was asking Lona the other day, without without sounding like I'm man-hating, I have a very supportive partner, please. I'm not man-hating, but it kind of just makes you look at guys and you're just like,
what do you do?
What have you done?
You were just there for the good part.
So there's this power that it makes you feel. So I can only imagine if you have a non-present partner or a partner who's not pulling their weight.
Or a person pulling you down.
Or someone who's pulling
abusing
you down, and then afterwards they're coming and they're like, give me. And you're just like, what
You're
are
like,
you?
absolutely not.
I know what I mean.
you're saying.
Like this feels, I mean, in my mind, this would feel like a lesser being than me.
Of course. Yeah, there's a huge disconnect.
Because I've done all this shit, and then now you're just coming to get laid.
So you can get me pregnant again. You're only there for the orgasm.
Thanks.
After that, it's all on me.
Thanks. I can see how I would not be willing to open my legs for such a person.
Absolutely. Yeah. So those are the things that can happen during pregnancy and delivery that can really affect your sex life after.
And you can see how that can also lead to like also marital rape.
Of course.
When you're just not ready, but your husband is like, look, I don't give a shit.
I give you your 6 weeks, let's go.
Yeah.
That happens a lot after delivery and even during pregnancy, because you're in a vulnerable position when you're pregnant, and you're not, sometimes you're not able to already, or you're having a high risk pregnancy and your doctor has advised against sex. So definitely marital rape does happen a lot in those circumstances.
Okay. I have another question. What are the symptoms of sexual... First of all, did we finish talking about what happens after delivery that may affect sexual health? But are you guys relating to this? No, you. Are you relating to this?
Yes. That's it. I was just like, okay.
Okay, so after delivery, some of the things that can happen, once again, are just body changes, which is physical. But now these are new body changes. Yes, the baby has come out, but now it's time to breastfeed. And with breastfeeding, there's a lot of eating that women tend to do.
There's a lot of leaking that's happening.
Exactly.
In your body,
your breasts are leaking.
I'm so scared about that part, the eating part.
Oh, don't be.
This time I've been able to
control.
And I'm just seeing how people balloon.
There's a hunger that comes with breastfeeding.
I was gonna say this
like a monster.
And it's different from first trimester hunger.
Babe, it's like you're
different.
attacked by hunger in a way you've never been attacked by hunger.
That's true.
And you have to eat because you have to.
You have to make milk, exactly. So there's possibly more eating that you're going to do, and honestly, caloric intake needs to increase during lactation, because you have to make milk and you have to make good quality milk. You could sit down and say, I'm only going to drink water, but you'll even notice it in your milk. You'll notice the things that you eat, how they affect your milk, exactly. So you shouldn't deprive yourself, but at the same time, it should be a balanced diet. It shouldn't be, you can't say like, oh, look, now that I'm breastfeeding to make milk, I'm gonna eat whatever I want to eat. I want to eat all the junk and all the everything. So it still has to be a healthy diet. You have to meet your caloric requirements. But with breastfeeding comes a lot of weight gain. And with weight gain, the body changes. And again, with breastfeeding, your breasts will drop. Your tummy will look different because it was previously distended. Now it's not. So body image issues come in once again, but in a completely new way. Because in pregnancy, I feel like we're a bit more forgiving to ourselves. We're like, okay, this baby's inside here. They're kind of occupying this space. So I kind of, it's okay. But then now after, you feel like a used vessel, honestly, because you're just like, okay, this came out and now this has dropped, and you're still left with someone depending on you fully 100%, and a fairly helpless human that's depending on you. So that can give you a lot of issues. And then women who get postpartum depression tend to have really huge problems with their sexual functioning after delivery. And the problem with postpartum depression is that you can't predict it. You can have a completely perfect pregnancy, completely perfect delivery, very supportive family and parents and partner and everyone, and then it just comes because it's a disease just like any other. And when it happens, not only are you not able to take care of yourself and your baby, you definitely can't take care of your partner at that point in time, for sure. You just cannot. And it happens, very erratically. There are some risk factors, of course, but it's really unexpected. So that's one of the things that can happen. And of course, just the hormonal changes again, hormonal changes that come with breastfeeding, hormonal changes now that the placenta has come out of your body, the estrogen and progesterone start changing completely. There's a hormone called beta-HCG, which is the pregnancy hormone. It starts to decline because now the pregnancy is ended. And even just that decline again can affect your sexual function as well. Then sleep deprivation, because you're not even sleeping. Nobody's thinking about sex. Like, honestly, sometimes it's like you haven't slept in months.
Oof. So the glow disappears. Does it? There people? Is there a post-pregnancy glow? You know, when you're pregnant and guys are like, "Hey, you're glowing."
When you're done in a beat.
I don't think there's a post-pregnancy glow.
Oh my God.
Yeah, I don't think so. It's it's also a time that because you're breastfeeding, you lose a lot of calcium. So your hair breaks, your teeth can chip, your nails can chip. I haven't had a post-pregnancy glow.
I recently saw an old video that I took, I think, when I was about a week postpartum. There was no glow there. Wow. There was only a tired-looking woman.
Sometimes I feel like one of the things that can help aesthetically is like, you know, the way sometimes you're very swollen during pregnancy. Once you deliver, that goes, and that's usually really nice. That at least that's the farthest you go glow-wise.
She was like, when does this pregnancy go away?
You just look at yourself,
honestly,
like,
it goes almost like a day or two after delivery.
Oh, that's perfect. Okay, I'll take that one. That's fine.
I was telling her I can't remember because after the baby comes, I was just
it's a blur. It's a complete blur. One of the other things that can affect sexual health after delivery is contraception. So when the baby is now 6 weeks, you start looking into contraception. You're like, okay, you know, you don't want to get pregnant immediately, possibly. And so because of breastfeeding, women tend to be advised to have progesterone-based contraception because progesterone does not affect breastfeeding. You can't have estrogen in your contraception. So basically now what you're looking at is having either an implant or an IUD or a progesterone-only pill. Or a progesterone injectable. Now, the problem with progesterone contraception is that it lowers libido. Really does, and it causes vaginal dryness.
Oh yes, I was going to say that.
I get actually a lot of my patients who are on progesterone contraception who don't want to continue with it. Their partners actually bring them over and they're like, "Hey, this thing, man,
it's a problem. Like, I'm giving you this progesterone so you can have sex. But then you can't have sex.
You can't actually do it. I know. So the dryness and the libido is one of the biggest reasons why women remove it. Of course, it also comes with weight gain, which is just basically taking us back to the same issues that we're having in the beginning. And yet contraception must happen. Especially if you've had a cesarean. You can't afford to be pregnant immediately after your cesarean. You really need your uterus and your body to recover. So progesterone-based contraception can also affect sexual health after delivery. And then of course we do still have things like, once again, culture and you know, like and poor partner support, because for a woman and for women whose libido actually does pick up, or you know they do want to have a good sexual experience even weeks after their baby is born, they're shamed into like, no, how can you be thinking about sex right now? You're a mother, supposed to be looking at taking care of your baby, you know. So it's like you can't win. It's a double-edged sword every time. So whether you are able to regain your sexual function or whether you start asking your doctor like, look, okay, breastfeeding, I'm kind of on it. Taking care of the baby, I'm on it. Taking care of my image, I'm on it. Okay, now what about my sex life? Which is something that many women actually don't even discuss with their gynecologist. And the few who do, honestly, get really brushed off. They're told, now you've just had a baby.
Don't worry about that.
That's not something that or you're just told, well, end up finding kegels, you know, which funnily enough is not always the solution to your problem, you know. And you have to talk the same way. Doctors need to be holistic. It's not about writing your prescription and sending you on your way. They have to discuss everything in your life. If you're lacking sleep, like maybe your gynecologist should be suggesting a sleep trainer for your baby. Or if you're not able to eat well, your gynecologist should suggest a nutritionist. If you're not able to breastfeed, you need to be given a lactation, because where are you going to go at that time? You can't start looking for each of these providers on your own. That's when like like holistic care comes into place. That's when your doctor tells you like, look, you know, if libido is already an issue for you, maybe we try a non-hormonal method that can help you with that, so that you're not further lowering your libido. So even just healthcare worker awareness to be able to help that problem of yours, you know, because culture is really debilitating women. Like it ties your hands. You're not able to look for the kind of sex life that you want. And that's a further problem. You know, like you talk about it to, you know, an in-law or a cousin or something, and then they tell you, I know these things, they happen to everyone, just deal with it. Don't expect much. Like that. Which is really unfortunate.
It's funny that you'd, I was just, as you were talking, I was just trying to think of my experiences both times after both my babies. And I think the sexual health conversation, the farthest it got, no, it didn't happen. It was as far as, these are the contraceptives that are available to you right now. This. That's during your first consultation with your doctor, your 6 week. The first time I went and I was like, oh, time to get back to sex. And I was like, it wasn't very nice. But all that was explained to me is these are the options available to you so that you do not get pregnant again. Like it's fear that drove me to get a contraceptive. In fact, the second time around, my doctor insisted that I do not leave without one. Without one. So I was kind of like read for a list of options. And then my doctor was like, so which one do you pick? So I'm sitting there, I'm like, bro, I need to go feed the baby. The baby is in the car.
I have bigger problems.
But it was never a conversation like, how are you feeling? No one ever asked me about how I'm feeling sexually.
Or your sex life.
But no one ever said, you know, take your time. No, they were just like, you need a contraceptive, otherwise you'll get pregnant.
See, theoretically, we're told at 6 weeks we have to introduce a contraceptive to a patient because that's the point at which she can now get pregnant. Before then, it's almost impossible to get pregnant.
And what are you?
But
are you even having sex before?
I was just about to say that many women are not even having sex at that point in time, you know, which is a good thing for me as a doctor because I get to introduce the contraception before you have sex. But at the same time, to the patient, she's like, look, I don't even need this right now because I'm not even doing it. So it's a very delicate conversation. And of course, again, it's better to have it with the partner, you know, because sometimes men really suffer. They want to actually resume this. And sometimes even the woman may want to resume this, but because they've never sat down to talk about this or talk about this with a third person, everyone is keeping quiet and wondering, okay, will it be really bad if I say I actually want to have sex?
He didn't want to overstep.
Exactly. He's also trying to give you your time, and even her, she's like, I don't want to look horny either. You know, like I want to look like I'm a mom now. You know, so it's a very difficult conversation.
Because we've talked about like negative stuff, but I'm assuming there are women who
actually want to.
Week 6, I'm like, I want that.
Let's go. Exactly. Actually, honestly, at week 5, I've had patients who come with like the episiotomy stitches are ripped, and I'm like, what happened here? She's like, look, I couldn't wait. And so that can happen as well. So there's some women who their libido does resume, but it's always a conversation, really. It is a conversation. And it's better when it's with the partner. It doesn't always happen, honestly. To be honest, majority of women.
For 6 weeks to come with your partner.
It's just nice so that even if it's not something that's going to happen now, the partner also feels involved. Like you know, like okay, when is this actually going to happen for us? How is it how can I make it more comfortable for my partner? What are some of the things like for example, if she chooses to go ahead with an implant, a progesterone implant, like he needs to be aware, like, look, libido might drop. It's not her refusing. It's actually just the contraceptive, you know. So also good conversations to have with our partner.
I like that.
Okay. All right. And so we've talked about sexual dysfunction, but then maybe you can tell us, in your experience as a doctor, what it actually looks like, qua ground.
I think we did that at the beginning, right? When we talked about the laxity, the dryness. Should I go through that again?
Just go through it like in
Okay. So,
bro, wait for 6 weeks.
So basically what it looks like to women, because sometimes they're not even clear on what's happening to their own bodies, but basically some women go through really bad laxity because, you know, and actually something to mention about laxity is vaginal laxity can happen because of vaginal delivery, or it can happen just because of pregnancy. Because during pregnancy, we produce a lot of progesterone, and progesterone causes the vaginal walls to stretch because your body is getting ready for a vaginal delivery. Your body doesn't know you may have a cesarean. So it's already preparing, like the pelvic ligaments start to stretch, the vaginal walls start to stretch. So laxity or looseness of the vaginal walls can happen to women who've had a vaginal delivery and also a cesarean. Of course, much worse for those who have a vaginal delivery than those who have a cesarean. Not to discourage women from having vaginal deliveries, but that's just a fact. So laxity is one of the things that's what it looks like. So a woman can have laxity, she can have low libido, she can have vaginal dryness, she can have painful sexual intercourse or penetration. Some women even get something called secondary vaginismus, where they're not able to achieve penetration, and yet they were previously able to achieve it, previously able to even have a baby, but then now all of a sudden, because of the trauma, the muscles of the vagina just start to contract involuntarily and no penetration can happen.
So vaginismus is when the vagina just
contracts completely, and it's involuntary. And that can happen after delivery. Of course, after having a baby, it's more likely that you'll get out of it, as opposed to if you've never, ever been able to achieve any kind of penetration. But that's a significant problem. So that's basically what it looks like.
All right. I think now, finally, since we kind of have first of all, I didn't know sexual health. It's called sexual health. I don't think a lot of doctors do this. So I'm happy that you're putting sexual health at the same level of importance as, pregnancy.
The pregnancy.
Because how else did you get there? You know what I mean? So what about solutions for some of these problems that women are facing? Somebody comes to you and they're like, I think I have secondary vaginismus. I think I have vaginal dryness. I'm unable to connect with my partner sexually because I'm just like, there's a lot going on for me. What kind of solutions do you offer?
So there are many solutions to this problem, and that really depends on what the problem is in the first place. Because not all female sexual dysfunction is the same. Some women don't even have it. But for the women who have it, it's all different. For some women, once prolactin levels lower, once they're done with breastfeeding, they're usually able to get back very naturally back to their sex life. It may not be 100, maybe like 80 or 90% of the baseline that it used to be, but they're able to return. So different solutions are offered for different problems. But one of the first things that I like to do is just for a patient to see her gynecologist and actually address it. Now, some gynecologists are not able to address it, fair enough, and that's why they refer patients to somebody who actually deals with sexual health after delivery, and just somebody who's better versed. And that's fantastic, because it's better to offer a patient a different doctor if you're actually not able to do it, and that's okay. But basically, your gynecologist should walk you through it and also list to you what your expectations should be. I don't expect you after an episiotomy 3 weeks later to be back at it and wanting to do it. And so expectations both for you and your partner must be laid out, and just to have a review of what your problem is and to be given a diagnosis and to look, for you, this might be hormonal, you just need to breastfeed, wait it out, and it'll get back to normal. Or for you, you had a very, very bad perineal tear, and this may need even reconstruction at a later date, because I do cosmetic gynecology, so sometimes with very bad episiotomies or very bad tears, sometimes you're forced to reconstruct at delivery and then again at a later date. So if that's your problem, then I'll tell you, look, this is something that you're going to have to wait out a little bit, then we will reconstruct. Sometimes even with really bad tears or nerve damage around that area, we do something called platelet-rich plasma infusions. So basically, we take your blood, we centrifuge it, we separate red blood cells from everything else. The everything else has stem cells, has growth factor, has platelets, and we inject it into those areas that have lost sensation and those areas that were damaged, and sometimes nerves can regenerate and the tissues there can regenerate.
What if you don't have a problem and you want...
You want to really
Which is basically what the O shot is. So the O shot,
like the orgasm shot.
So it's the same therapy, but now it is not.
But it's sexual health.
It's not. See, people have said it's not important, so that's why it's not covered.
Guys, we need to do better, man.
So that's basically what it is. It's platelet-rich plasma therapy, and it's able to regenerate those tissues. Of course, depending on your own body's capacity to regenerate. So everybody is different and has a different response. We also have solutions, like, for example, for me in my clinic, I offer radiofrequency treatment, which is like a thermal energy. It's a heat energy, and radiofrequency is not to be confused with radiotherapy. Radiotherapy is cancer treatment. Radiofrequency is a heat therapy. So it's a mild heat therapy, and And what it does is that it makes the vaginal walls produce more collagen and produce more blood vessels. Now, whenever more blood vessels are produced in an organ, the nerve endings become more sensitive. And so that improves sexual health after baby. I usually prefer, it can be done as early as 10 weeks after delivery, but I usually prefer to see, is this something that can end on its own, or does this actually require radiofrequency therapy? So it's a really good solution. The sensitivity in the vagina really improves. And sometimes when combined with the O-shot, the result is really fantastic. So that's a really good solution for moms. If the problem is, vaginal wall sensitivity or some damage that occurred in the vaginal walls. Of course, if it's a hormonal issue, we can obviously see, like for example, some women develop like a thyroid issue after delivery. So we have to actually treat the thyroid for that hormone to stabilize, for her to be able to return to a normal menstrual cycle and also have normal sexual health after that. Then also, if, for example, a woman has postpartum depression, those are things that need to be treated. And women need to not shy off from actually taking medication for postpartum depression. I personally had postpartum depression and I really shied off medication. I was like, oh my God, how is it going to affect my breast milk, which was already nothing, really, dwindling. But also like, is it going to make it less? Is it going to affect my baby? How am I going to feel? And honestly, in retrospect, I really should have just taken medication. I'd have been a better, mom. I'd have just been like more present, because it was a very difficult time, and it went on for a very long time. And also like I had to use natural things to help me, like I traveled, I, like sat in the open for a lot of time. I tried to bond with my baby more, and those were all good things, but it took much longer. It took much
we need to
longer.
actually discuss postpartum depression.
Absolutely.
Because I thought it's just hormonal, and then after the hormones destabilize.
No.
But I hear you can have postpartum depression even for years and years and years. And your kid is 7 years, but you still have postpartum depression.
Yeah, that
I
can
follow a
definitely
lady like
happen.
that.
Yeah.
She's had like 5 kids. She's gotten it with every child, and now she's generally a depressed person.
I can't deal
That's
with
very
that.
unfortunate.
And it's hormonal, isn't it?
It's not always hormonal. Sometimes it's psychological. Sometimes it's hormonal. And there are very many risk factors. Depends on your pre-pregnancy stage, your pregnancy stage, how you delivered, what happened after. Like it really varies, and it's completely erratic. It can happen to anyone at any time, and it's really difficult. So if that's the case, and it's affecting your sexual health, then it's better that it's managed and it's treated, so that then you're also able to perform, because you're a better mom and caregiver when you're yourself. Right? And then, of course, we need to make health workers like really aware that, look, this is actually a problem. When a patient comes and tells you 6 weeks later that, like, I would like to have a normal sex life, but I'm unable, that's something that you should address. The same way if she came and said, I have an infection, or the same way if she said, I have bleeding, you should take it with the same importance. Like, look, this is something she needs sorted, and this must happen right now, and we must find a solution for her. So basically, healthcare worker awareness is really, really important. And then also just to break, certain cultural barriers, like, look, it's okay for women to want a normal sex life after delivery. You don't have to shame them about it. The same way a woman comes and says, I'm not able to breastfeed to her friend, is the same way she should be able to say, look, sex is kind of not working after this baby. What can I do about it? And and it should be taken with the same importance, even by society, not just by your doctor, but also by society, with the same advice, like, oh, maybe we can take you to see someone, or like, how can we help?
Yeah, because I don't know if I had baby blues, or maybe I just assumed it's baby blues.
There's the difference between baby. I thought baby blues is postpartum depression.
There's baby blues, just generally the toll of having a baby, and then there's postpartum depression. But I honestly cannot define. I don't know where the line is.
Honestly, it's a gray line. Honestly, it's not that it's just black and white. Sometimes people define it according to the length of time that it happens. They're like, okay, if it's just 1 week, then it's possibly baby blues. But if it keeps going on, and then it gets really severe, you're crying all the time. Some women, it gets really bad because, and I remember, in fact, there are certain countries. I don't know if I'm not really sure if that's the case in Kenya, but there are certain countries where, if a patient goes and reports any kind of symptom of postpartum depression, she has to actually be detained, because she might be a harm to her own baby or even to herself. And I had a patient like that, and I remember thinking that once, because once when I worked somewhere, a woman came and she's like, look, I'm really sad, it's really difficult, I've barely slept, but also for the last few weeks when I look at my baby and when they cry, I want to like throw this baby out of the window. And we live on the 4th floor and her cot is near the window, and I was just like, Jesus Christ. And I personally just chose to detain her, even though it was not hospital policy, because I mean, I didn't know if she went home and actually did what she has
could.
said
Then
she's
even
going to
for
do.
you, you're like,
exactly.
It's
so
crazy. I think kwanza the human mind, it's madness. I saw
Yeah.
even another story on TikTok. This chick, she was suffering from postpartum. She just killed the baby.
Yeah, it can happen. You can be a harm to
the mom
yourself
came and
and
she
your
was
baby.
like, what the fuck has just happened?
Yeah.
And to her, she just sitting there. She's like,
because I can see how even
It's a psychiatric disorder.
Yeah.
Honestly, it's
You're not okay.
and I think the thing that makes people ignore it is the fact that it's temporary.
so itapita.
So people are like, itapita. But in that time, a lot of damage could happen.
Can happen, because I remember looking at my first baby, as in she's crying, she's wailing,
Yeah,
but
but
just
you
looking,
can't react.
I'm just like,
You just
can't
you're just
go.
overwhelmed. You cannot react anymore.
I could not do anything. I just watched this baby cry. Thank God I was not by myself. One of my family members came and took her.
It happens.
Oh, I think you told us this
Remember,
story.
in
Langata.
yes, in Langata.
and are you more predisposed to it if you had other mental health issues?
Yes, previous mental health issues are definitely a risk factor. There are many risk factors. When we actually do that episode, we'll talk about all of them.
Yeah.
But it can actually happen to someone with zero risk factors. And that's the scariest part about it. You know, the fact that you can be absolutely fine. You can have the best pregnancy, best delivery, best partner, best family, best financial situation, best everything, best even government support.
Yeah.
You know,
We don't have that.
but it still happens. Yeah. And that's the unfortunate thing. Yeah.
Oof, that's good.
Wow, okay, guys.
But I think there's like a few more solutions that I think I'd like
you
to.
had,
Okay,
so
please go
so
ahead.
partner support is one of the really big solutions to that. Yeah.
Okay.
So if your partner supports you, like for example, you feel a type of way about your body, and your partner is very supportive, and they're like, look, you know, you had our baby, you look beautiful, I love you. You know, like this was a really huge thing that you did for us because really only women can carry the baby. You know? And I think that
Wow,
honestly
I should-
helps.
That just sounds so nice. Even though you say, I know you're not telling me, but I'm just like,
You're feeling supported.
so nice.
But yeah, that's the truth, because with a really good partner, honestly, you can feel a lot better about yourself. But also, you know, a partner who's not just blindly supportive, but actually realistic. Like, I know your body has changed, but I actually still love you and I love the way it is, and you will get back to the way you used to be, and I will help you. You know, things like that. Not just deal with it. You know, So a partner support is.
I might hit on you when you're pregnant, like
Exactly.
We've had so many stories.
Of course, so many Chloes
in the
Oh,
world.
masking. But yeah, partner support is really, you know, a big deal. And then also some people should just, you know, possibly, you know, make terms with the fact that they may need to go for therapy. To just, whether it's to see a sexologist or to see an actual psychotherapist or a psychiatrist, because it's a serious issue. The same way when your tooth is paining, you go and see a dentist. This is also something that's actually affecting you. You should go and see a professional about it and see like what are the solutions that are available. So other than, you know, actual treatment, you know, your gyna reviewing your contraception, you know, your gyna can actually tell you, hey, by the way, this is happening because of this implant. What do you think? Maybe we should, you know, remove
change
it.
it up.
Yeah, because especially if it's really affecting and now your marriage is starting to get affected, you don't have to cling on to that form of contraception. There's very many good alternatives that you can use, you know. So a gyna review, you know, certain cosmetic treatments, because some women also form female sexual dysfunction because they don't like the appearance of their external genitalia after delivery. You're like,
sometimes the labia can become bigger.
exactly. Yes. Not always. Not always, yeah. So sometimes, and I do get a lot of women who come and say, I know this sounds vain, but I really don't like the way it looks. It's working, it's functioning, but it doesn't look the same. So for me, I just feel like, look, I'm a cosmetic gynecologist. For me, that's like cakewalk, and let's do this and we'll sort it out. But many times before I do that surgery, I actually have to assess, is she going through postpartum depression? Is she going through body dysmorphia? Is she like, what's happening? And many times I put it off and put them in. My patient's like, why are you wasting time? Like, let's do this. And I'm like, I'm still assessing you, you know, I'm still waiting to see, because some of them, 9 months down the line, come and like, was I the one wanted a labiaplasty? No, sorry, I'm actually quite fine right now with the way it looks, you know. But some still go like, look, this is still affecting me. I'd really like to change. On a realistic form, I've breastfed my baby. I'm actually quite fine right now, but I still want a labiaplasty because this looks very different from what it looked like before.
And I hear sometimes like excessive labia is it tissue?
Yes.
Excessive labia can actually interfere with sex. Like
it
can even enter, like the guy is trying to go in.
Exactly. So it can actually invade. That's the truth. And sometimes it's not even about sex. Sometimes it's even just daily functions like walking, running, like because there's a lot of
They go outside
friction.
your panty.
But exactly, or the friction sometimes is too much and they tend to tear. So if that has happened, like honestly, you need to shorten. You need a labiaplasty to shorten.
And can you have another
them.
baby after a labiaplasty?
Yes, you can. However, if they lengthen again after that other baby, you might end up having another labiaplasty. So for me, I like to do it for those who are done. But there's some who say, look, I want this labiaplasty. I will deal with that other pregnancy later. Or I will have a cesarean in the next pregnancy. Something like that. Yeah.
That's fair.
Yeah.
I feel like by the time you've gotten to 1 year, you've also kind of like acclimatized to having a whole new human in your home, in your life. So you're able to, I think, compartmentalize the baby and now yourself as a sexual being. Because I feel like after 1 year, at least in my experience, both times, life has started to get a bit easier, where not everything is about
surrounding the baby.
Not everything is surrounding the baby. Now you're moving around, you're doing stuff, you're doing fun stuff with your friends, you know? Yeah. And then I also wanted to add something about when you're talking about healthcare professionals. First of all, I wish all healthcare professionals who deal with a lady who has had a baby and whatnot approach it like you, because like I said, in my experience, sexual health was never discussed. Second time around, I chose my doctor based on how competent I thought he would be in taking care of my baby. Was he someone I wanted to talk about sexual health with after?
Possibly not.
Nah. Because some of the things that you've mentioned, I think one of the things you've mentioned, I think I was actually going through in terms of sexual dysfunction. But we navigated it with my partner. At no point did I think, maybe I should talk to this guy. I didn't want to talk to him about such things. So I think it's also important to have somebody that you're comfortable being open with. I think I'd have been more open with, say, somebody like you. Or I don't know whether maybe it's a lady or I don't know. But he was not somebody I wanted to talk to about sex.
In such times, you can actually also, you can actually, because sometimes you do want, and I totally understand about your choice of gynecology for the
job
for the skill at delivering.
Yes.
Yeah. And then after that, there are so many things that come that, sometimes it's difficult for one doctor to do very many things. And honestly, I feel like once your reviews are over, and if sexual dysfunction is still a problem, you can still seek a second opinion. It's okay to change your gyna after he has served he or she has served the purpose that they were supposed to serve. And if you feel like maybe you guys didn't develop, a rapport to the extent that now you can talk about sex, because that's a completely special relationship. That's not, you don't just talk about that to anyone. And of course, that is influenced by many things, maybe the age of the person, their skill set, how your consultations have been. Sometimes, honestly, you're seeing a gyna because that's what your insurance has provided you with. That's the only person you can see. You don't really have much of a choice. But then after that process is complete and a lot of the financial part of it has been covered, and now you maybe have some extra money to have a second opinion, you can always do that. Like patients can do that.
The other thing I wanted to add was on a supportive partner. When you had mentioned somebody who makes you feel good about yourself, I think that's fantastic. But another thing I also wanted to add is somebody who also takes away some of the practical burdens in your life, I think can also really help you get in the mood, possibly. I think, not even money, like somebody who is changing the diapers, feeding the baby so that you can sleep. Someone who's facilitating the little comforts that you can possibly have at that time. My God, that is like the sexiest thing you can see at that time.
Absolute sexiest.
At that time,
honestly,
you're just like, daddy,
okay, you want to start having sex again and you're not ready.
I completely agree with that, because it's not even just about how appealing your partner looks at that point in time. It's the physical burden that they're taking off you. Because when you're well rested and you feel like, look, we've kind of shared the load on taking care of this baby, you are definitely in a much better mood. So it's not just someone who's like, hey, cheerleading you, but also actually,
you look amazing, baby. Good job, baby.
But so like it's someone who's actually taking, because there's a whole list of things to do with a baby. And if someone can share that list with you, definitely that definitely helps.
It goes, I mean, it gets closer to the bud. Like you feel it in your vagina.
Getting some wetness coming back, the dryness disappears.
You know what I mean?
It does. It really does.
Just when you said that, I've remembered what at my baby shower, you guys, when you were sharing like tidbits and advice.
Yeah.
And a man changing the diaper should not be glorified.
True.
I think someone said that. Like they're literally doing their job. So
Yep.
every time your hubby or your baby daddy changes a diaper, takes the baby, feeds the baby, it's not at
You don't have to open your legs.
You don't need to open your legs and clap for them. They're doing what they're supposed to be doing. It's their job to take care of that baby as well.
Yeah.
So
Something to remember.
All right, guys. Wow. Okay, Christina, thank you so much. I think we've come to the end of this
nice episode.
extremely
You're most
informative conversation around sexual health, pre, during, and post
Yes.
pregnancy.
Yeah.
Right? Like I said earlier, Dr. Christina Sule, she has her own practice, Allura
Yes.
Medical Center. Where is it located?
It's in Upper Hill, in 40 Suits.
40 Suits.
Yes.
Anyway, if you can just look her up, Allura Medical Center? No.
Practice.
I'm Allura Medical Practice. You get all the details that you need. Thank you so much.
Yeah.
You're a breath of fresh air when it comes to medicine.
Said.
This is how gynecologists are looking nowadays.
Yeah, this is what medicine looks like, guys.
And I really do
Thank you
applaud
so
doctors who are also trying to connect with audiences in these spaces, the digital space. I know sometimes there's some resistance, maybe from the OGs. They're like, why do you need to advertise yourself? But sometimes, like for me, I think even just being in this space, first I'm like, oh, you mean I can talk about sexual health with my gyna, not just sexual reproductive.
Yes.
You know what I mean? And there's also things we've learned so much about ourselves through interacting with you and being on our 25. So we do thank you for that.
Thank you so much. This information needs to be available to patients freely.
Yes.
It's a lot of hard work, even for the doctors who do it. Doing your own YouTube channel, making this information even just relatable and understandable, because we have a lot of jargon in our head, but just breaking it down, to this is what you need is really difficult. But thank you guys so much for having me. I really, really, really appreciate it.
And I think we also need to mention she has her own
Yes,
YouTube channel.
and on that note, Christina also has her YouTube channel. It's called The Free Consult.
Yeah, your free consult.
Your Free Consult, which I think is also very good, because we get a lot of questions. Sometimes we do, we've done conversations in the past around, let's say, contraceptives. And somebody asks, where did you go? How do you do this? It's like, we don't know. We actually need a professional to answer these questions. So if you have any questions regarding the conversation we've had today, please go to Your Free Consult on YouTube, and you can leave your question on her on her YouTube channel, or just leave it on this particular episode. I hope you'll be able to go through our comments and maybe respond to some of the questions that people have regarding sexual health. If you've enjoyed this episode, guys, please remember to give this a thumbs up, leave a comment, some feedback, maybe your own personal experiences. Share this conversation with somebody who you think might benefit from this conversation. One or two people, an aunt, a sister, a brother, maybe there's a man who needs to understand what happens and how these things affect.
Men really need to watch this episode.
I think men. So actually share with a guy. Share with a
challenge you to send it to a guy.
Share it to a guy. And as per usual, subscribe. She goes back.
Because it's free.
It's free, guys. It does help us a lot when you subscribe. It's a way of supporting us. And we'll see you back, guys. We'll see you guys back here next time. Peace.
Bye.
Over 25, subscribe.